Fiber. Fiber is very important in your diet. You should get about 30 grams of it daily. And the reason for this is not only because fiber lowers your cholesterol by binding to cholesterol in your gut and preventing it from being absorbed into your bloodstream, but it also improves insulin sensitivity. Therefore, it helps with lowering your blood sugar. It helps to dilate your blood vessels by the potentiation of nitric oxide. Therefore, your blood vessels become larger in diameter. Therefore, your pressure drops. It can help with weight loss because it helps you to feel fuller for a longer period of time. But one of the best benefits of fiber is that it can help you to reduce the risk of developing diverticular disease. Now, diverticular disease, 60% of people over the age of 60 have diverticular disease. 65% of people over the age of 80 have diverticular disease. And what it is a condition that occurs where you have outpouchings or little pouches or pockets forming on the outside of your large colon. Your large intestine, specifically the sigmoid colon, is most affected. Now, what can happen is that this can affect your bowel habits, meaning you can have diarrhea, you can have constipation, you can have pain in your lower tummy, and you can have bleeding. Sometimes these outpouchings can become infected, and when they become infected, you no longer have diverticular disease alone, you have diverticulitis. Diverticulitis can lead to a lot of different complications, such as fistula formation, meaning feces can be translocated from inside of the colon itself to the outside, which is a bad thing inside the tummy. You can have abscess formation, and one of the worst things you can get is what we call a lower GI bleed, or you can have bleeding from the back passage in large amounts. This happens in a lot of people yearly. Its occurrence or presence has been attributed to a Western diet. So consuming 30 grams of fiber daily could help reduce the risk of developing diverticular disease. Also, reducing fatty foods or fried foods could also help to reduce your risk of developing diverticular disease. So fiber is not only good for your heart, it's good for your blood vessels, it's good for your pancreas, or just your general overall well-being. It also is good for your weight, and it's really good for your gastrointestinal health. So if you really want to improve your health, increase your fiber daily. So 30 grams daily.